other things that can look like seizures and why we may not be right and why our treatments for seizures may not be working on something, right? So we'll start with syncope. Multiple etiologies, of course, it's a final common pathway for loss of perfusion to the brain. Vasovagal is probably the most common type, and within that you have different descriptions of vasodepressor syncope, neurocardiogenic syncope, or reflex syncope housed there, cardiogenic with things like asystole, bradycardia, or tachyarrhythmias that don't allow for enough chamber fill to eject back into the arterial system to perfuse the brain. You can also have it, of course, with heart failure for similar reasons, but without rhythm changes. Neurogenic in a more pure autonomic neuropathy, which is fairly uncommon. And then, of course, the relatively bread and butter, or the static. I stood up too fast, I got lightheaded, I passed out. Now, much of the time in the clinic, we see syncope, but we see syncope that has some atypical features, right? Bread and butter syncope does usually not make it to the neurology clinic because usually the questions don't exist, right? There's something about the syncope that happens that leads to questions about, well, we think it might have been a seizure, or we're not sure what it is. And so with this, as with anything else, the history becomes very important. And anytime you're not sure about whether somebody is having seizures or something else, do everything you can to really nail that down in the history, because that's really the only information you're going to have outside of being able to monitor symptoms that produce physiologic changes. So what's the context? Is there something in the environment? Is there a positional change? Is there Valsalva, right? If somebody's often having these in the bathroom, that's a common place to have a reflex syncope or a vasovagal syncope. What's the volume status? Are there some comorbidities, particularly cardiac comorbidities, that fall in line with this? What are the early symptoms? Do they endorse the lightheadedness? Lightheadedness is kind of a vague sensation. In epilepsy, people can describe, of course, auras that they say are undescribable. It's difficult for me to say what's going on, but I feel something that's familiar. People with syncope are often able to describe pretty well what they're feeling. You know, I feel lightheaded, I feel unsteady. Vision changes are not uncommon, right? Often a tunneling of vision from the outside in, but it can go inside out. They can mention stars are flashing. They can be diaphoretic, very sweaty. Somebody, if you have the benefit of a witnessed account, they'll say, well, they looked ashen, they looked gray, they looked just completely washed out, right? During the event, this is often what leads them to the neurologist's office, right? If there's stiffening or myoclonic jerks, which are actually fairly common in syncope to some degree. Actually, many years ago, they did a prospective study, as much as you can do one on syncope, of patients who were